the statistic here in America is that 100 million Americans don't brush their teeth twice a day, nor do they go to the dentist yearly. And that's really tragic because the number one killer here in America is cardiovascular disease. So I really want people to stop thinking about, oh, it's just my teeth.
Yeah.
Your whole body is connected. Your teeth are organs, they are linked to other organs, and your teeth poop. So brushing just gets off 60% of the poop. The rest is in the toilet bowl, and that is the space between your tooth and your gum. So people think, oh, well, I brush my teeth twice a day. I'm good. I'm not going to lose my teeth. Not true. You can lose your teeth from gum disease because unless you're cleaning out that bowl, that bacteria literally rots the bone. Now, you would think that that would hurt, right? But it doesn't until the last stage because your bone has no nerves. It's just like when you get a cavity, you don't feel a cavity when it's in the enamel because the enamel has no feeling. Only when it hits the nerve do you realize that you have a problem. So in gum disease, anytime you get bleeding, either when you brush or floss, that's a sign of infection. Your gums should never bleed. It might be common, but it is not normal for your gums to bleed. That's like saying, when you wash your hands, your cuticles start to bleed, and that's okay. It's not okay. Something is wrong. It's your body's way of telling you, hey, there's an issue here.
Welcome to Your Wordless Podcast, the space where we redefine success, self-worth, and transformation. I am Nick Nieras, the soul-centered architect of transformation, helping you unlock your highest potential and build a legacy beyond limits. Now, whether it is self-mastery, career breakthroughs, or wealth creation, this is where change begins. Now let's dive in.
Thank you so much for having me.
Thank you. Can you first share with us? I'd like to take this a trip down memory lane with all of my guests and my listeners. What was it like growing up as a Heather Paul and then Heather the Hygienist? Or what's the sequence?
Well, I can tell you, I did not think I was ever going to end up as a dental hygienist. That's for darn sure. But I was raised on a farm in Minnesota and Wisconsin, and my parents were hippies, so they were into all things natural, and that's kind of how I grew up. But then when I got pregnant with my twins unexpectedly, I started having complications and I had to be on bed rest. So that gave me a lot of time to really research things. And then when my girls were born prematurely, one of my little girls had just a lot of allergies. She actually had 25 different food allergies. So I had to really learn how to read a label because obviously it would affect my daughter tremendously if she had something in there she was allergic to. So I was really shocked at what they could put into our food. I mean, we're talking petroleum products and all kinds of chemicals. That kind of transcended into oral care products. And about 2010, I started just looking at the ingredients that I had been promoting as a dental hygienist. I was taught in dental hygiene school, fluoride is the end all be all, and anyone that doesn't agree with fluoride is a conspiracy theorist. I was actually told that by my instructor. And so, I didn't question anything until 2010. And then when I started looking at the ingredients at commercial oral care products, I'm like, what the heck are these ingredients allowed in, our products? But it's because here in the United States, oral care falls into the same category as cosmetics. So that's why they're allowed to put toxins inside of oral care products. But whatever you stick in your mouth, Nick, gets into your bloodstream because your mouth is the most vascular part of your whole body. So I just became like on a pursuit as to, well, what can I recommend? And so I went into health food stores, started reading labels, and even in health food stores, surprisingly, there were ingredients that I just was shocked, they were putting in there. Honestly, I read a proverb every day. One day, I think this was in 2014. I read Proverbs 8:12, and it says, I, wisdom, dwell with prudence and give knowledge of witty invention. So I asked God for a witty invention that day. And then months went by, and here we are. It was 2015. I was getting ready to open up my fridge in the kitchen, and like God downloaded the ingredients to Simply Silver mouthwash. I was so stunned. I went over to my computer. I just started like looking up the ingredients he told me, and there was nothing on the market like it. And here we are, years later, and now I've got what eight oral care products on the market, and
Wow.
two books, and hopefully be able to educate people about the importance of what you do stick into your mouth, how it affects you, and that your teeth are, it's your mouth isn't a separate compartment from the rest of your body.
Well, I've always been, I would say, proud of my teeth. I mean, thanks to my mom, always instilled in us, my sisters and I, to brush our teeth at least our teeth twice a day whenever we go to our dentist at school. And I think kindergarten, they would say, or they'll give us a certificate. I would be so happy when it's like it's time. Oh, okay, Nick gets one certificate because she takes care of her teeth. But then I also saw some of my friends who were scared of going into the dentist's office. So now I guess my question is, like most people, like I have a younger sister who's 12 and she does not like to brush her teeth.
Mm.
And I don't think that's exempted to only kids, they're also adults.
Mhm.
So why is it important, Heather?
Well, actually, the statistic here in America is that 100 million Americans don't brush their teeth twice a day, nor do they go to the dentist yearly. And that's really tragic because the number one killer here in America is cardiovascular disease. So I really want people to stop thinking about, oh, it's just my teeth.
Yeah.
Your whole body is connected. Your teeth are organs, they are linked to other organs, and your teeth poop. So brushing just gets off 60% of the poop. The rest is in the toilet bowl, and that is the space between your tooth and your gum. So people think, oh, well, I brush my teeth twice a day. I'm good. I'm not going to lose my teeth. Not true. You can lose your teeth from gum disease because unless you're cleaning out that bowl, that bacteria literally rots the bone. Now, you would think that that would hurt, right? But it
Yeah.
doesn't until the last stage because your bone has no nerves. It's just like when you get a cavity, you don't feel a cavity when it's in the enamel because the enamel has no feeling. Only when it hits the nerve do you realize that you have a problem. So, in gum disease, anytime you get bleeding, either when you brush or floss, that's a
Yeah.
sign action. Your gums should never bleed. It might be common, but it is not normal for your gums to bleed. That's like saying, when you wash your hands, your cuticles start to bleed, and that's okay. It's not okay. Something is wrong. It's your body's way of telling you, hey, there's an issue here.
Are you stuck in a job that you don't love, feeling like you're meant for more? It is not in your head, it is in your soul. I am Nick Nieras and I help high achievers like you break free from burnout, rewire self-doubt, and build a life aligned with purpose through coaching, hypnotherapy, and soul activation. Because let's face it, real wealth isn't just about money, it is about aligned and happy heart, mind, and soul. Now, remember, you are worthy and you are enough. Let's transform your life together. Visit www.thenicknierasholisticlifestyle.com to begin.
And flossing is like exercise. It might hurt a little bit at first if you do it properly, but the more you do it, the easier it gets and the better it feels. So people think also using those little cheater flosses is flossing. That's not flossing. Again, because your teeth poop, you're just transferring bacteria from one part of your mouth to the next. And because it doesn't hug the tooth, those little sticks are very, very taut. You're maybe getting 1 to 2 millimeters in between the teeth, but it's not getting down into the bowl. That's why you need to use manual floss. And that's why you need to floss properly using your middle fingers, not your index fingers. That will help you get to the back teeth. But you have to have good oral care routine, or it's neglect. And it's really silly to think that we can not take care of ourselves and not have a problem because teeth problems are extremely, extremely expensive. Here in the United States, insurance has a benefit of maybe $1,500 to possibly $2,000 a year. One crown is $2,000. So it can really definitely get very expensive quickly because of neglect. So I always tell people floss the teeth that you want to keep, make sure that you brush twice a day, but you don't want to wait till something hurts because usually by then it's too late and too expensive to fix.
Tell us, what do you mean by poop? Is it the plaque?
So because your teeth are organs, right? They're excreting. So, when you wake up in the morning, you have morning, right?
Even though you
It
brushed the night
smells.
before.
It smells like poop,
Right.
right? I mean,
Okay,
even if
okay.
you don't floss for a few days and then you get in there and you really floss, you smell
Yes.
the floss. It smells like poop. And that is literally a bacteria that's excreted that is anaerobic, meaning it thrives in deep, dark spaces. And this bacteria can cause bacterial infections. And again, you've got one tube, it starts here and goes all the way out to you. If you have an infection here, it is getting into your bloodstream. Now we can screen with a saliva test. There are 11 bugs that cause gum disease. So we can screen for, goodness, Alzheimer's, pancreatic cancer, colorectal cancer, diabetes. All of these things start in the mouth. We can now
Is
determine
that right?
have the precursors for Alzheimer's and all of these things. Don't you want to know? I mean, this is not even
Yeah.
widely done here in the United States. It should be. It should be available. And I wish insurance covered the test, but they don't. It's like $29. But if you can prevent something from happening, don't you want to, be able to stop that? There's actually 2 bacteria out of that 11 that are so virulent, they're resistant to doing a deep cleaning. That's why you have to treat the root cause. In my book, Dentistry Made Easy, I talk about the root causes of disease. It's not always a poor home care kind of a situation. Sometimes people have underlying issues, whether it be a bacterial infection, MTHFR mutation, oxalate toxicity, mouth breathing, compromised airway. So there are root causes in periodontal disease or rampant cavities where you have, teeth are getting cavities. There's always a root cause to something. So I think we need to stop looking at the mouth as, oh, it's just my teeth, and start really addressing this as, oh, maybe the problem is starting here instead of, piecemealing everything together.
What about the food that we eat? Aren't those things like, contributing factors to
Yeah.
disease?
Absolutely. So how you get a cavity, Nick, is if your saliva drops below a 5.5, that's where the acids are really starting to erode your enamel. Okay, so that's how you can get a cavity. The main cause of cavities is dry mouth or open mouth breathing. What's that is doing is that's preventing your saliva from being its natural protectant. But foods, drinks such as soda has a pH of between 2.5 and 4, right? So it's phosphoric acid is the number one ingredient. And by the way, that's what they etch cement with is phosphoric acid, but they put it in food and drinks because it's sweet. So you're drinking acid, okay? So it takes 3 days for your body to come back to a natural pH of 7 from one soda. If you are constantly drinking soda, you are literally think about it. Okay, you've got one tube. Think about a zipper, right? From here down, and you open up your organs and you stick your organs in a 2.5 to 4. Long term, is that gonna, make you healthy? No, I think it's gonna create disease. And your teeth are the windows to your bones. So addressing the root cause, whether it be soda or the simple carbohydrates, those break down into simple sugars. So it's not just sugar, it's sugar plus plaque, that poop on your teeth, which forms an acid. And that acid is what eats away at your healthy tooth, making it soft and sticky. So, lack of vitamin D, that's, a major contributing factor, especially for women, because we only have until we hit menopause to be building our bones. So it's super important that we get enough vitamin D. And also the organ meats and protein and healthy food. I mean, you are what you eat. So if you're eating junk all the time, that's going to reflect into in your mouth. I mean, back in the day when they would buy slaves, what did they do? They had the slaves open up their mouth. They'd look inside their mouth. Why? Because that's an indicator of how healthy that slave was.
Whoa.
You know,
Okay.
we
Yeah.
totally just neglected this, and people are all about exercise and eating clean, which is great. But if you have a disease in your mouth, you have systemic disease. So that's why, we need to stop thinking about the mouth as like a separate compartment. And people will say all the time, oh, well, just pull on my teeth. And I'm like, yeah, we can amputate. We can amputate your hand. We can give you a prosthetic limb. Is it ever the same? I mean, your teeth are literally linked to organs in your body. You have meridian points. So we can amputate, but if we put people in dentures, it decreases their lifespan by 10 years. That's pretty significant. So no, we don't want to amputate. We want to be able to keep your teeth and keep them healthy. Now, I am against root canals because root canals remove the blood supply and the nerve from the tooth, making it a dead tooth inside your body. which is unhealthy. So I'm not about keeping your tooth at any cost. If that tooth is infected, you really should see a biological or holistic dentist to have it removed properly, and then you have alternatives for replacing teeth. So I'm not about, I want to keep my teeth at all costs. If that tooth is infected, I don't suggest a root canal at all.
How do we know if a tooth is infected?
You would have pain. Remember how I said
The nerve,
so if you have a cavity that's gone unchecked, right? Because
right?
you didn't go to the dentist, it got into the nerve, and it'll make an abscess. And that's when you know, oh my gosh, I gotta go to the dentist because they waited too long. So, and then standard of care is what they do is they drill in through the tooth, they remove the nerve, put bleach inside the tooth, seal it with gutta percha, and say, now it needs a crown because it's a dead tooth. It'll turn black and it becomes brittle. So it would have to be covered. But I tell you, in 30
That's
years,
brutal.
constantly, root canal teeth fail. They fail. If it lasts 8 years, it's considered a success. But, all 100% of root canal teeth have what's called endotoxins in there. That's because you cannot remove that bacteria. Even though you have, 3 or 4 canals or however many canals in your tooth, depending on which tooth it is, you have microtubules, at least 75 microtubules down into the bone here that you can't access. So you're sealing that infection inside your jawbone, and that, you know, everyone's different. For someone's immune system, maybe they can not realize that they have any problems, but for someone else, that root canal can put them over the edge, and they don't know why they don't feel good. They have all of these problems, but no one's making the connection or even asking, do you have a root canal? Which tooth is it? And let's see where it is on the meridian chart and see, about removing that source of infection and seeing how the body responds to that.
Wow. I have not been flossing a while, I have to admit. And I think this is a message I needed to hear today. I will go back to it. And so I want to talk about the part where you said when you brush your teeth and it bleeds, what could be the cause of that? Hi, I'm Nick Nieras, your host of the Your Wordless podcast. Now, if these real raw stories hit home, don't wait. Please follow, like, and subscribe my Spotify and YouTube. For bite-sized inspirational reels, follow me on Instagram, TikTok, and LinkedIn. Don't wait. Your transformation starts today. Thank you and bye for now.
So it starts out with inflammation, right? Inflammation is pretty much the root of all disease. So if the gums get inflamed and bleed easy, that's called gingivitis, right? Gingivitis is just an inflammation of the gums, but it can progress to periodontal disease, and that's disease of the bone. Your teeth are sitting in your jawbone. So what that bacteria does is it rots your bone. I don't know if you've ever spoken to someone and it's like literal death breath. I mean, it can knock you on your feet. That bone rotting, that's periodontal disease inside their mouth. And that is literally going through their bloodstream, and you can't really regrow that bone back. So we don't want someone to have periodontal disease. I mean, who wants rotting bone inside their head, right? So we want to prevent that bone from deteriorating. And the way to do that is to clean the bowl, remove that bacteria with floss. Now, if you already have active disease in your mouth and you have a pocket, which when you have nice, tight gum tissue, it's pink, it's firm, it's tight, right? But as that inflammation grows, you get a space between your tooth and your gum that just keeps opening, right? And all this bacteria gets into the space and the gums are all inflamed. And that is called a pocket, that space, right? That I'm calling the bowl is a pocket. And a healthy space, a healthy pocket would be 1, 2, or 3 millimeters in depth with like a little tiny ruler. If I'm getting 4s, that's a sign of gingivitis. If I'm getting 5s, there could be some bone loss starting. 6s and 7s, huge problem, probably active disease. So we want to definitely keep those pockets, keep those spaces tight and healthy. But floss is only going to go down to 4 millimeters. So if you have active disease, brushing and flossing isn't going to be enough for you. You have to use like a water pick, and I actually talk about that in my I have a whole protocol in my book. I explain everything you need to know about gum disease and the protocol, what to do, the foods that you need, foods to avoid. It's really a handbook for people because I just, I see people so afraid of the dentist and I want to make it better for them. But, you have to work with your provider. I mean, if you're not ever flossing, if you don't go to the dentist, and then when you do go, you get a $15,000 treatment, you can't get mad at the professionals. It's not our fault you neglected your teeth this far. So I really want people to be proactive and prevent disease, and that will make their visits so much easier. Knowledge is power, but you can't just, not take care of something and then expect a good outcome. That's just not going to work.
Yes. So hitting the nail on the head. Okay, talk to us about the importance of a mouthwash and what's the regime like in your silver mouthwash.
So the whole reason why these commercial oral care products are so detrimental to people is because that mouth has an oral microbiome. And what I mean by that is there's 800 different bacteria in our mouth, both good and bad, right? But what happens is that bacterial infection that can create the bad bugs to flourish, and that puts our oral microbiome out of balance, right? It's called dysbiosis, where the bad bugs are flourishing, so we want to make a good balance of bacteria, both good and bad. But your commercial products, fluoride disrupts the oral microbiome. Alcohol extremely disrupts the oral microbiome. 27% alcohol can cause throat and mouth cancer, can cause high blood pressure. So you definitely want to look at the ingredients in your oral care products. You don't need something to foam to be effective. If it's foaming, there's like shampoo in your toothpaste, which is called sodium lauryl sulfate, and that can cause canker-sores. You don't need a foaming agent to get clean teeth, right? You also don't want to be brushing away at your enamel using harsh abrasives. Your teeth, your enamel does not regrow. It can remineralize, constantly remineralizing and demineralizing when you eat. So you don't want to disrupt that process. Like after you eat something, Nick, you don't want to brush your teeth. You want to wait 30 minutes before you do because your saliva is naturally trying to protect your teeth. So you need to wait 30 minutes before you brush. But you want to use products that are going to support your oral microbiome. And what I love about colloidal silver is it only kills the bad bugs and not the good. So it's not going to disrupt that oral microbiome. And I have things like coconut oil in my toothpaste, nano hydroxyapatite, which again, you don't need fluoride for strong teeth, right? If you look at fluorine on the periodic table, it's a halogen. It's a mutagen. And here in the United States, actually, there was a lawsuit that was won in a federal court against the EPA, which is our Environmental Protection Agency, because of having fluoride in the water. And they were able to prove that it's a neurotoxin. It reduces the IQ. It causes cancer. But here in America, they love sticking it in the water. So you don't need fluoride for strong teeth. Your teeth are made out of 97% hydroxyapatite crystals. So you want to use something like nano hydroxyapatite because it's bioidentical to your enamel. So your body recognizes it. That will help keep your teeth nice and strong. So you want to use, products like that. And also you don't want to use something abrasive. Anything over 70 is kind of considered abrasive, which even a lot of your sensitive toothpaste, like Sensodyne, is between a 72 and a 79. Some of your charcoal toothpaste, it's like 150, 200. You're basically using liquid sandpaper to brush your teeth. That's harmful. You're in
I'm thinking of all the products I have in my bathroom right now, like
because we think
going
we
through
want
the
white
list in my
teeth, so we want to scrub the heck out of them, thinking that's going to make them whiter. That'll make them more yellow because the more that you wear through your enamel, the more yellow your teeth are. That's the inside of your tooth is yellow. So you keep wearing away your enamel, your teeth are going to get more and more yellow as you wear through that. Your enamel is the whiter part. So you don't want to be using harsh abrasives. And again, in my book, I talk about all the ingredients you want to avoid. So my toothpaste is a 31 and a 32 on the scale. Extremely safe for veneers, for your enamel, for long-term use. And also my toothpaste doubles as an oil pull, which oil pull, that's been around for centuries. It's an Ayurvedic way of detoxifying the mouth, and coconut oil is great for that. But, again, I want you to think about alkalining the mouth, reducing the acids, supporting the oral microbiome, getting rid of ingredients that are going to disrupt what your body has. I mean, this is your mini immune system, your digestion, everything starts right
It's
here.
from the mouth. Yeah.
Right. So, we need to stop this disconnect that we have between our teeth and the rest of our body and really start saying, geez, what I am saying I know can be overwhelming, but just make one small change at a time. Stop using commercial oral care products. Throw them out. You're doing more harm to your body than good. So hopefully I can teach people, to just, like I said, make one small change at a time. So it's not overwhelming, but really start paying attention to what can I do to make myself healthier and include oral health in that.
So it wasn't wrong for me to get you onto the show. Like, I love it. I love it. Thank you so much for that mighty beneficial info, Heather. I would definitely keep it. So I'm going to show off to my friends and say, hey, I talked to an expert who's actually saying that this is where it starts with everything, because you are, like you said, you are what you eat, and we break down everything edible through this part of our body. And so,
Right here. Yep.
yes. And yeah, all the more reason you got to take care of it. I mean, there's no point in exercising and getting that six abs or summer bod, but this is not taken care of. It'll
Exactly.
be
And
a complete turn off.
people have so many misconceptions. And I have an entire chapter in my book called Dental Myths and Misconceptions, because there's so many. I have like over 50 mentioned.
Share with us 3 at least.
So one of them I've already stated, that it's normal for gums to bleed. No, that's not normal.
Okay.
Goodness.
Okay.
I had people thinking that put bleach in your water pick. No, don't do that. That's terrible.
Wait, what? Put
People would
bleach?
put bleach inside their water pick and then irrigate that throughout their whole mouth.
They do that? Okay.
Yeah. Yes, they do. I've had people brush their teeth with Comet, which is that abrasive stuff you clean sinks with.
Well,
Yeah, people do all kinds of crazy things. And I guess the skull and crossbones on stuff doesn't deter people.
yes, it should. God. Okay. That's why we
Yeah,
need to get
I had
you
a guy
on
that
to
did brush his teeth for 17 years one time. So, yeah.
what. Okay, may I know what was the reason he didn't brush his teeth?
I had to ask. I had to ask. I needed to know. So he told me that he actually got hit in the mouth with a lead pipe at 13 and just never picked up another toothbrush again. So by the time he came in to see me, he was in a lot of pain, and that was because his bone had rotted so badly. I wasn't even able to clean his teeth because the only thing really holding his teeth in place was all the tartar buildup. His bone had pretty much rotted away. So there wasn't even going to be really enough bone to hold a denture in place. So the poor man, he also smoked 2 packs a day, drank a liter of soda a day. I don't even know if he's still alive. He was in such poor health. But, he came in because now he was in pain and it was so far gone. There really wasn't anything that we could do. So, and I also give the analogy of having a vehicle. When you have a car, there's maintenance involved, right? You have to put oil in your car. You need to get your oil changed every 3 months. So take that concept into your teeth. If you're somebody that has periodontal disease, if you're someone that tends to build a lot of tartar, you're going to need to get quarterly cleanings, right? If you're somebody that's more cavity prone, you don't really have gum disease issues, you tend to get more cavities, but you don't really have much plaque buildup, you can get away with 2 cleanings a year. It just depends on what category you fall in. Usually people fall in one of the two. Sometimes people have an issue with both. But again, there's a root cause that is not being addressed. So we need to figure out what that root cause is. And like I said, the number one cause of cavities is open mouth breathing. People are mouth breathers. Well, our mouth is not meant to.
When we're talking, or like
Talking is
subconscious,
different, but just
unconsciously.
breathing, like breathing through your mouth and not your nose, that keeps you in a state of fight or flight all night. So a warning signal would be someone who's snoring at night with their mouth open, right? Because you're your lungs are not meant to filter the air. It can take 65 days for your lungs to filter the air that your nose does in 15 minutes. And then you don't get any nitric oxide. So what happens is you end up with too much CO2 in your lungs. So,
Wow, that's
so
another episode.
overbreathe.
I love that.
Yeah, you overbreathe, but people just don't realize that they have a bad habit of mouth breathing instead of using their nose as designed. So, again, that's a root cause. So we need to address the airway in that scenario. Is their airway compromised? Do they have a posterior tongue tie where that tongue is too tight to the floor of the mouth, preventing that airway from being open? So, hopefully people will start being educated and get to the root cause, find a provider that's going to look at all of the things and do the right testing and figure out what's going on, because we want to treat that root cause to get you healthy.
Absolutely. I saw a question on mercury fillings. Yeah. Is that the same as root canal?
No, so
No.
mercury fillings are those silver fillings that people have in their
Right.
mouth, and we typically don't use mercury anymore. People call them silver fillings, but by weight, they're 50% mercury. And, back in the day when we had thermometers that used mercury, if it broke inside of a hospital, they'd have to close down the entire floor, send in a hazmat unit to clean up that mercury, but somehow it's safe inside the mouth.
How ironic.
I mean, anytime you're eating something hot or cold, it's expanding, contracting, and releasing vapors. And you can get heavy metal poisoning. We don't want mercury close to your brain. So you also don't want to just go and drill it out without the proper protocols in place. And again, in my book, Dentistry Made Easy, I talk about the protocols, the difference between a mercury safe dentist and a mercury free dentist, because when you drill out that mercury, that vapor is going everywhere and you're going to be exposed to more mercury if it's not done properly. That's why you need someone who's a mercury safe dentist that's going to have those protocols in place so that you're not overexposing yourself. But we have options now with the composite resin, which is the white filling. So you shouldn't have any metal in your mouth. Again, these are all, it could be a root cause of maybe someone's having tremors or brain fog. That can be heavy metal poisoning. So you'd want to get a hair sample, right? Test and see if you're testing positive for heavy metals. That's a very high possibility, right? But then again, you'd want to have that removed properly. So yeah, just really so much of dentistry today is not geared towards holistic health. It is really the complete opposite. So my approach is all holistic, again, looking at the body as one piece, not a separate compartment, getting to the root cause. Hopefully people will find a right provider. I know that there's not a lot of holistic biological dentists necessarily around every corner, but if it's your health, and you've tried so many things and you're having health issues, definitely make an appointment with someone that is at least somewhat close to you and see if there isn't a root cause, because you could have a cavitation site, which cavitation means dead bone. So when someone pulls a tooth, right? If it's not pulled properly, there's tissue, dead tissue around the tooth that needs to be removed, kind of like a placenta. If a woman gave
Right.
birth and she didn't remove the placenta, she could die. So what happens is that if that dead tissue isn't removed around the root of the tooth, the brain does not send the signal to the body to repair that area. So it can create a cavitation site, which can create a long-term problem. But because it takes like 30 years to develop a problem, you don't necessarily put two and two together. So if you go to a holistic dentist, they have different equipment, like a cone beam, and a cone beam can determine like the hot spots in the mouth, certain thermography. Not all thermography is created equal, but determining again the hot spots. There was a doctor, Dr. Joseph Eisels, here in actually he was in Germany, I think, and he had such high success rate of treating breast cancer, but he would not work with women that had root canal teeth unless they were willing to remove that root canal tooth, because what he found is the correlation of the root canal tooth to the side of the breast. that it was on. So, so he had them remove those root canal teeth for sure. Well, and
Okay.
the whole reason that I even got into understanding about root canals is because in 2010, my husband kept getting swollen glands, like huge underneath his, it was the right side. And I just I was like, what the heck's going on? And so I took an x-ray, a 2D x-ray. I didn't see anything, but I just had this gut feeling that it was the root canal because he had a root canal tooth in tooth number 30. And so I started researching root canal teeth. I was shocked about, because we're just not taught this in dental school. It's just, this is the standard of care. This is what you do. And that's it. So when I really started looking into that whole connection, I'm like, oh my gosh, I think this tooth is infected. I took him to a biological dentist. This is, again, in 2010. And when the holistic dentist pulled the tooth properly, he said it looked like black oil was down in his bone. It was indeed infected. Sent him to get an IV to clean his blood. And, after we put a bridge in there to replace the missing tooth, he never had that swollen lymph gland again. So, I mean, there's definitely a
Whoa.
correlation.
I'm compelled to ask. I have this. I know we're supposed to pull out our. I don't know how many. Maybe one that I can remember very vividly. But then there's another one, but it's like horizontal like this. And I'm still scared of taking it out because it's horizontal and it's like only the tip is showing. But when it's horizontal and then you have your teeth next
Mhm.
to it, and then there's like the space, right? And when I floss, I go there, and then you can smell it, like
Yeah,
you said.
you're gonna
Yeah.
have to have that taken out. So teeth should be through the gum, right? I mean, that is what a tooth is designed for, is to be through the gum. So when it's
Mm.
not all the way through, think of it like an ingrown hair. And your body is going to send like white blood cells to the area, can even form a cyst around it. But if you're not able to keep it clean or it's compromising the tooth in front of it, you should definitely have it removed. Problem is we have a nerve. It's called a mandibular nerve. If we wait too long as we get older, that root kind of is called ankylosis, where it just forms into the bone and it becomes very difficult to remove and can cause nerve damage. So if we foresee that, hey, this tooth is coming in sideways, there isn't enough room in the jaw for that tooth, then you would want to have
Take
it
it out.
removed properly. Again, that's the key, because a
Okay.
lot of cavitation sites from wisdom teeth can be linked to heart issues.
Okay. Okay, Heather. I will do just that. Whew. All right. So, what are the simple changes people can make today in terms of their oral hygiene routine?
Well, like I said, you want to wait 30 minutes before you eat. So what I do is, as soon as I wake up in the morning, I scrape my tongue, because again, your teeth poop and have all that bacteria, right? Because your teeth are organs, they're excreting as you sleep. So scrape the tongue with like a stainless steel tongue scraper. Like, you don't want to kill your tongue, you just want to scrape the bacteria off. Makes me gag every single time. That's normal. And brush my teeth first thing when I wake up in the morning. Those are the two things that I do. And then, later, of course, I'll eat breakfast or whatever. I'll rinse my mouth out with my Simply Silver mouthwash, because that helps with, establishing the remineralization process and just cleaning out any bacteria. And then you want to floss your teeth for sure the proper way, which on my YouTube channel, Simply Silver Mouthwash, I have videos on how to floss properly. You definitely want to throw out your commercial crap, because look at the ingredients. I mean, do you really need to be putting poloxamer 407 in your mouth, and the most vascular part of your whole body? Sodium saccharin, dyes that are banned in other countries but allowed here. I mean, we don't need concoction. And
America.
I think that you can poison yourself to good health. I mean, it has a poison label on it. If you were to buy sodium fluoride on Amazon, it's the skull and crossbones, folks. It is a labeled poison. It's a drug. You don't need it for healthy teeth. Okay. So hopefully making that paradigm switch, with using a more natural product, really taking their oral health more seriously going to the dentist, making an appointment, getting your teeth cleaned, because people think, oh, well, I can do it myself. I don't need to go to the dentist. Yes, you do. I am a dental hygienist. I get my teeth cleaned 3, 4 times a year. So, it's extremely important. I can't do it myself. You really need to make sure you're, going to the right provider to get care. But don't neglect your mouth. Hopefully, people will make those simple changes. Get the book, educate yourself, so you have questions to ask your dentist. Because how do you know when you have a cavity? Just because someone tells you that you have a cavity, I actually teach you what a cavity looks like. I show you pictures of good dental work and bad dental work. Hopefully people will become more educated and feel more empowered to make some better decisions for their oral health.
Thank you. And you're doing that great work coming on to podcast and speaking, Heather. Thank you so much. Okay. What are you working on currently?
Well, I just finished my second book is called The Great Tooth Deception, Revealing the Dark Side of Dentistry. So I'm going to be flying out to Texas next week and have a podcast with the doctor who wrote the foreword for my book. So that is kind of what I'm working on right now. But yes, just trying to get the word out for people, doing more podcasts, hopefully one at a time.
One at a time.
Ground here.
Indeed. So what is next for you?
Well, I would love to be able to focus full time on my business at some point. It's simply silvermouthwash.com. That's my website. But I would really love to maybe do more public speaking, get into some bigger venues where I can have, more people. The more people that hear this message, hopefully, the further it will go. Because dental decay is the #1 disease in the world. So it's not just an American issue or, from a Malaysian issue. It's a worldwide issue that we have. So hopefully people will take it more seriously.
Yes. Okay. Heather, we're gonna pivot to a self-worth question. So, because my podcast talks a lot about self-worth, and I think the question for you in my head right now, how do you define self-worth? And can you share any personal experiences or stories that relates to your self-discovery?
How do I define self-worth? Well, I feel like my worth comes from knowing who I am in Jesus Christ. I mean, he's he's given me everything. Have a relationship with him. I couldn't make it without him. So I know my worth is in who God believes and created me to be. And I just want to walk that out as best I can. With his help, he guides me, he directs me in the way that I shall go. And I give all praise and glory to him. And, giving back is very important to me because we support right now 2 orphanages because I feel that, he didn't give this to me just for myself. It's to benefit and bless other people. And that's what I really want to do. And I want to be able to bless more and more people as the company grows and really give back to community because I think too many times people are focused on just self. We're taking these selfies and it's all about self, but it's not about us. And, I think when you realize that, hey, I'm not in control of the universe, God is, and I just let him lead and direct my life and open up the doors that he needs to open and close any door that he needs to close. But hopefully we can really touch people's lives.
And you're doing just that. What is a heart's greatest wish?
My heart's greatest wish. Oh, well, I would love to be able to help everybody, but that's not going to happen. I want to be able to help as many people as I can. And the dentist that did the forward for my book, Dentistry Made Easy, we were talking about having a contest where people could write in and tell their story about, like do a whole smile makeover for somebody. Oh, I would love that.
Yeah, that'd be good.
Your smile says so much, and so many people have, they're self-conscious. They hate their smile. They've not been able to afford anything. Being able to give a gift of a smile to somebody, that would make my heart really, really happy and be able to help children. Really want to be able to help the kids.
Thank you. If you could create a quote right now for you to leave to the audience listening and the world as your legacy, what would it be? Thank you for that, Heather. So how can people reach out to you?
Email Heather at simplysilvermouthwash.com or through my website, simplysilvermouthwash.com. You can reach me that way too, but it's through my email. But yeah, that should be an easy way for them to get a hold of me.
Any last message before we wrap up the interview?
Don't wait, don't let fear stop you. Take control of that. Bring an advocate with you and don't let fear stop you from attaining what it is that you want, whether it be a healthy smile or anything in life. Just don't let fear stop you from.
Yeah. Thank you. Well, that is a wrap on today's inspiring episode with Heather the Hygienist. Thank you for the work that you do, Heather, and for continue to uplift the world around you. And for our listeners, this has been Your Wordless. Read that again, the juxtaposition of your very soul. Now, if you've ever felt wordless, remember you are not alone. Your soul chose to be here to matter. And for that reason alone, you are worthy. A huge thank you to you again, Heather, and to all of you for listening. Until next time, I am Nick Nieras. Keep shining, keep growing, and always remember you are worthy and you are enough. See you in the next episode. Thank you so much, Heather, for your time.
Thank you.
Love this episode? Now, transformation doesn't end here. Head on to at holistic.lifestyle_with_Nick. That is on my Instagram. Or head on to my website, www.deniqueras.holisticlifestyle.com for more info on my coaching framework, which is the Worthy, Authentic, and Abundant Framework, digital guides, and my upcoming events such as retreats and master classes and workshops. Now, I also do intuitive readings where we get to check on your soul path. And if you're also wanting to check on your energetic alignment, I have done that too. And I offer that kind of services. So, my question to you is, are you ready? Because I am. Let's create your together. Hi, Heather. How are you doing today?
Great. How are you?
I'm doing very well. Thank you so much for asking. And thank you so much for saying yes to the interview today. I'd like to introduce myself to you formally and to all of our listeners tuning in for the first time and or returning subscribers. My name is Nicolette. I am the creator for the podcast titled Your Wordless. Read that again, the juxtaposition of your very soul. Now, people who are actually my audience they'll be guessing like why suddenly we're going to talk about the danger or the benefits of keeping your dental hygiene on, top tier, like top notch. So, but I love learning and therefore thank you for saying yes to be interviewed today. Without further ado, I'd like to introduce you to all of our listeners and then we can get right into our conversation. Hello, everyone. We have Heather Paul here with us, or also known as Heather the Hygienist, a certified biological dental hygienist, registered dental hygienist, and orofacial myofunctional therapist with nearly 30 years of experience. She's passionate about educating others on the vital connection between oral and systemic health because a healthy mouth is the foundation of wellness. Now she's here to debunk dental myths, expose hidden risks in conventional dentistry, and share effective natural solutions. Welcome to the show, Heather.